Thank you so much, Madeline. It's really an honor to be with you all today. Thank you for joining. And I just echo Madeline. We would love to connect you to our broader work in the Theology, Medicine, and Culture Initiative. And please consider studying with us or spreading the word about these seminars as you go about your work. It's my real pleasure today to introduce Dr. Anne Biro, who is presenting our TMC seminar for today. Dr. Biro currently serves as the president of Nurses Christian Fellowship International, a position she's held since 2021. She's passionate about the work of NCFI because of the difference it's made in people's lives in so many different countries, both nurses and patients. Anne's own background in nursing has been in a variety of areas, acute care and community, teaching, research, and policy. Most recently, Dr. Biro has been volunteering as a nurse consultant in Mongolia, where she joins us today, where it's midnight her time. So we're really grateful that you're with us. I understand having just traveled today from Korea, where you were at a meeting. So it's quite impressive that you're here with us. Thank you. She also worked for 5 years with InterVarsity Christian Fellowship of Canada, a time that she values as having helped her grow in the integration of faith and work. Dr. Biro will be presenting to us today on the topic of the nursing profession and Christian nurses integrating faith and work. Thank you so much for being with us for the TMC seminar.
Thank you. It's a real pleasure for me to be here with you today. I'm just going to put my slides up here for you. I think we're ready to go. Okay. Absolutely pleased to be able to present, especially with the theology, medicine, and culture, because those three really do go together. So just before I launch in, I just wanted to share just a little bit more about myself so that you have a good idea of where I'm coming from. So I'm married. I've been married for over 34 years. As you know, I am a nurse. I graduated in '88 and I identify as a Christian. I have had a lot of exposure to different Christian traditions and expressions of faith, both liturgical and non-liturgical, evangelical, Catholic. I've worked and interacted with interdenominational organizations and ministries. So I've had quite broad exposure regarding faith, but also with life experience. So I am a Canadian, in case you wonder where my accent comes from. But I also consider at heart that I've got a little bit of African in me. My elementary school years were in Africa. I have a bit of Asia in me. So I've been living here in Northeast Asia off and on for over 20 years. And that's not an insignificant period of time as far as shaping one's thinking and way of being and doing. And then I've also lived and worked in a variety of other countries. And one of the things I love doing is staying with local people rather than in hotels. And it's a gift because I like to see where and how people live, because that really helps give me an understanding of what life is like for them and what faith in life is like, especially for the Christians that I stay with. So Maureen kindly mentioned some of my background work and current work. So I think I'll just continue on from there. So my question for you to think about is, what is a Christian nurse? I'm sure when you hear that term, something comes to mind. And if you've got a paper and pen, just take a moment to jot down your first thoughts. And I ask this because all of us have assumptions about what a Christian nurse is or what a Christian nurse should be. And in my work as president of Nurses Christian Fellowship International, or we say NCFI for short, I often ask nurses this question. And for the most part, I find that responses to this question fall into one of two categories, and maybe you can assess it for yourself. The first one is about identity, and it relates to where people feel they belong. For example, I and others identify identify me by such characteristics as my passport country, physical characteristics such as skin color and hair type, belief system, and type of job. Just think for a moment about how people introduce themselves. Hello, my name is Anne. I'm the president of Nurses Christian Fellowship International. Or it could be I'm a Canadian currently living in Asia. Christian nurses do the same thing all the time. I'm a Christian nurse. Sometimes this has significant meaning, but other times it's simply a descriptor, such as my being Canadian or having curly hair. The second way of understanding what a Christian nurse is by culture. Culture has been described as basic principles, standards, core beliefs, and key norms that help us make sense of the world and how we act or behave as a result. From the perspective of what it is to be a Christian nurse, this includes ways of being and thinking that include lifestyle, ethics, witness, and how we think about and do our nursing work. Just last week, I was at an NCFI leadership seminar where I met a nurse who's from Asia who said that in the country where she lives, Christians are very much a minority group, and Christian nurses in particular. She said that most Christian nurses think of their lives in separate realms. So as a Christian, their identity is focused on being a member of a church. But when they go to work, their understanding of their nursing work is usually disconnected from their identity as a Christian. It isn't that they cease being a Christian, it's just that, well, there isn't a connect between the two identities, being a Christian and being a nurse. As a Christian nurse myself, this is a disconnect that I have both seen and heard about. Because the Christian faith by nature should be incarnational, in other words, a lived faith enmeshed in every aspect of our lives, helping to connect these two aspects of our being and doing is something that is really important. And just a note to say that different people will journey in different ways in making this connection. And I'd like to share with you one example of a nursing colleague, actually my best friend from nursing. And I've just given her a caricature here, and just a little disclaimer, all my art is courtesy AI. So that's why there's no credits on my art. So for many years, my friend from university, who I will call Phoebe, attended church off and on. She identified as a Christian, but Christian, I'd say, was one of many descriptors, which, similar to the diagram in the slide before last, wasn't directly connected to her work as a nurse. After a number of years, she shared with me that she had recently come to a living faith that was more than just an intellectual belief or philosophy or habit of just going to church. She said she understood at a deeper level about her need for Jesus and the salvation found in him. So I asked her, how does your faith integrate with your work? And she told me that her intention at the start of each nursing shift was to be guided by God in her work. But to be honest, at the end of each shift, she felt there simply had been no time to even think about God during that entire shift. She desperately wanted to make that connection, but it wasn't happening. Fast forward a few years, and her growing faith had led her to engage regularly with a spiritual director, not a nurse, but a spiritual director. And Phoebe eventually decided she would also take training as a spiritual director. Not that she planned to practice, but she just wanted to delve in a little bit deeper. So I again asked her, how does your faith integrate with your work? And her response was completely different. This time, she said that she experienced God's presence throughout the day. She said that earlier, when she was younger in her spiritual maturity, she had thought that she needed to consciously stop and pray or think about God. But since she'd been learning the spiritual disciplines, especially that of examine, she had learned to discern God's presence and leading in ways that might seem unconscious at the time, but that she knew was very much God's leading. She gave an example of one time that illustrated this quite well. She said she was doing her medication rounds one evening and had a sudden impulse to check on a patient. So instead of giving medication to the next patient on her list, she popped into the room of the patient who had come to mind. As she entered the room, she found the patient in respiratory distress and was able to respond immediately, both helping the patient recover and calming the distraught family members who'd been in the room at the time. She said to me that she had no doubt that God had put that impulse in her to check on the patient. Before, she wouldn't have acknowledged that as God's presence working in and through her, but as a result of regularly doing the spiritual discipline of examine, she not only was able to acknowledge such impulses as truly being the work of the Holy Spirit, but she said she was also more attuned to discerning and following up on spiritual prompts in the workplace. In addition, she felt that as she grew in her faith, it resulted in personal growth, which made the fruits of the Spirit more evident, love, joy, peace, patience, and so on. And so that qualitatively changed her interactions with patients as well as with colleagues. Something that was noted by her supervisor when she told Phoebe that not only was Phoebe doing excellent nursing care and was competent in her nursing practice, but that she was the favorite nurse of the patients. And that to me is just a beautiful story of how faith can integrate with nursing practice. So in Phoebe's story, we can see how she moved from simply identifying as a Christian nurse to her living out a spiritually transformed and attuned life in her nursing work. My hope and prayer is that more nurses would experience that life-giving connection between their faith and work, and that as a result, there will be a positive impact not only on them, but also on their patients and colleagues. Sadly, for many, the meaning of being a Christian nurse is often limited to church culture expectations rather than life in all its fullness, or it's constrained by the assumptions and laws of the non-Christian culture in which they live. For example, I'm going to give you a few. So let's look at lifestyle markers. I remember speaking to a medical doctor from Africa, and he was really concerned about his daughter's faith. And the reason was his daughter liked to wear makeup. For him, lifestyle choices such as wearing makeup or the outward appearance was an indication of whether or not someone was a Christian or a Christian nurse. And this was part of the local culture for Christians. Another example of cultural understandings of Christian nurses I have met included Christian nurses from South Asia who felt that what distinguished them from non-Christian nurses was that they prayed for their patients, including offering to pray for patients before such procedures as surgery. A Christian colleague who worked in China said that nurses who weren't Christian would often leave some of their work undone. But they didn't worry about it because if they knew there were Christian nurses on their team, the Christian nurses were known to have a strong work ethic and also very patient-focused. So as a result, Christian nurses would make sure that the patient care tasks were completed by the end of a shift, even if it wasn't their assigned task. Another example, a Christian colleague of mine in Mongolia recalled an incident where she'd not charted a child's vital signs. And she didn't do it because the child had been crying and she couldn't, she just wasn't able to take it in the midst of the infant crying. So her non-Christian colleagues urged her to write something in the chart before the doctors came, because they said that if there wasn't anything charted, the doctors would reprimand my colleague. But my colleague said she was a Christian, and that meant she couldn't write down the vital signs if she actually hadn't taken them. So even if the doctor got angry at her, she refused to write it down. So in her workplace, she was known for truth-telling. And interestingly, as an aside, she actually got promoted, which went totally against what her colleagues would have thought. And that doesn't always happen, but it did in this instance. Here's another example. So a nurse from Europe told me that as an evangelical nurse, it meant that they took an ethical stance, opposing such medical procedures as abortion, euthanasia, sometimes now referred in gentler ways, such as medical assistance in dying, or gender transition treatment and surgery. When I was nursing in Canada's subarctic, and we were considering whether or not we would have a nursing union come in, everyone assumed that because I was Christian, it meant I was opposed to a nursing union. I mean, that wasn't the case, but that's the general assumption of what it meant to be to them about what a Christian nurse was. A nurse I met from Africa said that her understanding of what it was to be a Christian nurse was to see nursing as a platform in which you could witness to patients, which basically was interpreted as encouraging patients to accept Jesus as their savior. Now, I defined it because I think being a witness has many different meanings, and some will choose, like this one, to have a more narrow definition of what that means. So this was not something that was taught in nursing education, but actually from the church that the nurse attended. So witnessing persuasively with words was considered acceptable for her. But we know that in other countries, such as in the UK, USA, Canada, Australia, Christian nurses feel they're no longer free to speak openly about their faith, or at least in many cases, they feel no longer free to speak about their faith. And in some places, there have been court cases and professional discipline for a few nurses who've been reported about speaking about their faith, or sometimes even wearing a symbol of their faith, such as a cross on a necklace. Implicit in all the examples above is the assumption that to be a witness means one has to speak, explaining the words in the gospel in words, or praying in Jesus's name. However, from a biblical worldview, to be a witness is much more than words and involves one's whole life. But sadly, in the disconnect between church and work, the understanding of incarnational faith and witness is often limited. One final comment on this slide as to the understanding of culture and Christian nurses is how Christian nurses view their work. Do they view it as a calling from God, as nursing's most famous nurse, Florence Nightingale, did? Or is nursing simply a career? So it's a good question to ask. You might have picked it up from the way I was explaining the last few concepts, but I think a key understanding is the importance of the term being. Being implies complete integration. It includes identity as a Christian and as a nurse, rather than it being reductionist, like on that one slide where the nurse was either at church or in the hospital. So being implies that we live it out in every aspect of our life, and not that we'll be perfect in living it out. As humans, we're all fallible. As Paul wrote in Philippians 3, verse 12 to 14, it's not that we've already reached perfection, but rather that we focus on faithfulness to the life God has called us to and seek to live that out in all our being and doing, and I think sometimes confessing as well, because that's real. Okay. In seeking to understand the challenge of nurses living out their faith in professional practice, I think it's helpful to understand both cultural and identity factors and the influences in the nursing profession. I'm not sure how many of you today are nurses, but for the next part of this seminar, I want to do a very brief overview of influences on the nursing profession. And they are broad summaries, and so I hope you will hold it a bit lightly in the sense that knowing that these are just very broad brush strokes that give you a bit of background about the history of nursing, and specifically looking at what some of the influences were, with an eye to understanding what Christian influences have been. So those are the topics on the slides that I'm going to take a quick look at. So let's take a look at early nursing. So we're looking now at the shift from early nursing towards professionalization of nursing. So if one goes back far enough in time, you'll know that the work of caring for health needs was typically performed by women. Many were known as traditional midwives or healers, and they used remedies, for example, herbs. And usually this knowledge was passed on from one generation to the next. These are roots of nursing, and probably you could argue medicine to some extent as well. And so these types of traditional healers and midwives can be found all over the world. Now, from this point, I'm going to leap to references in scripture. So for following years. So caring is a term often used to describe nurses and the work they do. And it's used a lot in the Bible. And I would have loved to have done a word cloud when I started out, but I didn't have the technology up on my slides, so I didn't. But I expect some of you, when I asked you what it is, what a Christian nurse is, some of you might actually have put someone who cares, or a caring caregiver, or something like that. There are many nuances to the meaning of care, caring, and caregiver, but I'm going to leave that for another discussion for you for perhaps another day. So I do want to note that there are many biblical examples and teaching that shape or should shape a Christian understanding of people who are caregivers, who care for other people's health needs. So some examples in the scripture are traditional healers and midwives. So the most well-known is probably from the book of Exodus, about the Hebrew midwives who disobeyed Pharaoh. But there's other references too, such as when Rachel gave birth to Benjamin, Joseph's brother, and had a midwife who assisted her. Massive leap forward, we can see that Jesus's teaching also included teaching on the important ministry of care of the sick and injured. Parable of the Good Samaritan is a good example. And, you know, it's interesting that in that parable, it focused on someone caring for others who were neither family nor the same nationality. And that, for the most part, was a bit countercultural. As recorded in Matthew 25, Jesus indicates that caring for those who are sick held the same importance as if they were caring for Jesus himself. And then, of course, especially in the New Testament, but also in the Old, there are many instances of healing, and therefore the value of healing, including some that were clearly very holistic in nature. And probably one of the best known sort of holistic healings was the healing of the woman who had a bleeding problem. And Jesus ministered to her by calling her daughter, in addition to the woman's bleeding being stopped. And then if we look into the early church, there's just small windows that indicate that healing continued to be a part. Peter and John healed a lame man who was sitting outside the temple. Paul laid his hands on and prayed for the healing of a man named Publius from Malta. I just picked out a few examples. There's many more. And although caring for the sick was not specifically mentioned, deacons and deaconesses, such as Phoebe in the Bible, were helpers in the ministry of the church. Just as an aside, that's why I called my friend by the name of Phoebe, just because of that link. So if we move now to the early church, one of the doctrines of the early church was charity, and that can be described as love for others. So whenever the church embraced charity, it led to care of the sick, the poor, and the needy. So early and clear examples of the church responding to the needs of the sick occurred during times of plagues. So historically, there have been no cure for plagues, and therefore nursing care was the main treatment. So when we think about that, it's important to think about what it was like in that age. And so for the most part, cultures historically didn't value the sick or the dying. And therefore, when Christians cared for the sick and the dying, especially when it was at considerable risk to themselves, others started to take notice. Why would Christians do this? Well, theological understanding of biblical teaching on care of the sick and needy, for example, commands to care for the sick, the golden rule to love others as you would want them to love you, and the teaching that there are no differences in the sight of God between rich or poor, slave and free, and I would add, this is my add, sick or well. So those provide foundations for a theology of caring for the sick. Personal risk was acknowledged, but not considered that important, not only because of the biblical imperative of caring for the sick, but also because of the promise of eternal life, which meant that Christians didn't have the same fears of death that many others had. I also suspect that, as John noted in his letter in 1 John, where there was love, fear was driven away. Having said that, it's important to note that there have been times when Christians didn't provide nursing care due to fears or prejudice, such as during the Black Plague in Europe, when many Christian leaders refused to go into the homes of those who were sick, or when they fled to remote areas, or when nurses placed or Christians placed higher priority on values such as following orders that fell under the guise of actions being for the greater good. Some of those we now consider to be unethical and totally inappropriate, but it was rationalized. It's important to acknowledge wrongs that were done, because sometimes the responses of Christians have indeed been more like the Pharisees and the Levite in the parable of the Good Samaritan than what we think should be the ideal. And they're examples of where rationalization has been used to excuse oneself from what God has actually called us to do. This reminds us that the impact of Christians can be for the glory of God, or it can be negative. So in the Middle Ages, nursing care was done through the church, and generally that was facilitated by wealthy Christian patrons. One such patron was Elizabeth of Hungary, about 1200 AD, and her influence had been Francis of Assisi. And so as a result of that, she started helping the poor and the needy. And then following the death of her husband, that meant she got her dowry returned. And so she built a hospital for the poor and sick and was renowned for the care that she gave. In addition to the needs of the sick and the poor, nursing services were also needed during times of armed conflict, and still are. But in the Middle Ages, of course, that included the Crusades. I mention this because during the Crusades, we are told that rather than women, Christian men were recruited as nurses for military, religious, and lay orders that would provide nursing care for wounded and sick soldiers. Some of the most well-known were the Hospitallers, the Teutonic Knights, and the Knights of St. Lazarus. So while many people, when they think of nurses, they often think of a woman, I just wanted to say that there have been many men who've been recruited to nursing. And in a number of countries, actually, there's quite a lot of men in nursing. As culture changes and beliefs change, so has the church. So in the 1600s, there were many more religious orders established to care for the sick and the poor, as well as for sending out missionaries. Most care by Christians was that of nurses or other caregivers, trying to alleviate physical symptoms and check on their spiritual state. So they were very much intertwined. However, based on reports from the 18th and 19th centuries, it seems that by then the quality of many of these had slipped. Okay. And now we get to the precursors for modern nursing's professionalization. So in the mid-18th century, significant changes in nursing and medical care began to take place. And if you study history at that time, you'll know that there were significant social and technological upheavals in Europe. So think of the impact of the Industrial Revolution or of the French Revolution, the social revolution that took place in France in the late 1700s, and then also of the communist revolution that took place in Russia in the early 1900s. So this was happening. Another issue was that although many hospitals had been set up by wealthy benefactors as acts of charities, as I just mentioned on the previous slide, most hospitals had become the place where the poor would go because they didn't have other options. They had higher rates of infection and deaths than for those who were cared by home. Hospitals were often run by orderlies or matrons who were tasked primarily with housekeeping and carrying out doctors' orders. But we've been told by what's been written down that many orderlies and matrons had no education, and they took the job more for money than out of a desire to serve. So it really took the work of Christians who had a strong sense of calling and who were innovative to bring about transformation in this area. And most notably, they began with the Reverend Thomas Fliedner and his wife Frederica, and then followed up by, of course, Florence Nightingale. So the move away from mostly unregulated care of nurses and doctors into the more regulated, or we would say professional models of care, was facilitated by advancements in science and technology, which changed treatment options tremendously. and resulted in massively improved health outcomes. For example, consider the impact of the microscope, germ theory, and changes in medical practice. So these scientific advances contributed to the increased focus as well on medical intervention. So you're starting to see a switch from religious to science and tech, from nursing and care to medical intervention. One medical historian wrote, "For the first time in history, cure of the body and care of the soul became separated." At the same time, a philosophical paradigm shift was also occurring, and that of holism, body, mind, spirit, became more reductionist. So, and that was linked to rationalist ideas of Descartes, who divided the human body into material and non-material components. This period in history also saw hospitals starting to appoint medical doctors as directors. Why is this important? Because from a nursing perspective, with medical doctors gaining esteem and running hospitals, it naturally had an impact on the role and identity of nurses. So for those who have an awareness or have done some gender studies, you'll know that European society at the time was very much male-dominated. Medical doctors were almost exclusively male, as the prevailing theory at the time was that women's role was to be wives and mothers, and that they didn't really, as women, have the capacity for understanding science and medicine, politics, or the character qualities needed to run organizations. In many countries, and especially in the Soviet Union and satellite countries, doctors viewed nurses as people who could assist them in their medical work. Thus, by putting hospitals under the direction of male doctors, nurses lost some of their autonomy, both in their work and in their identity. Many medical doctors saw nurses as people who would carry the treatments they prescribed and who would assist the doctors in procedures. And while to some extent that wasn't new, and that it also very much continues today in many places, the more reductionist focus by the emphasis on medicine and science and technology meant that the holistic approach that had been valued by nurses kind of fell off by the side. So now we're moving forward to the more recent history of nursing. And again, we'll talk a little bit about Thomas Fliedner and his wife, Frederica. So they were passionate about helping people in poverty or who had been convicted of some offense and just weren't able to restart life. So rather than giving them just the basics of food and shelter, they wanted them to have meaningful work. So as I mentioned earlier, during the 18th century, it was actually hard to find reliable, hardworking people to work in hospitals. Orderlies or matrons were, had the housekeeping and followed the doctor's orders. But because of the conditions of the hospital and minimal pay, we're told that people who took those jobs were usually those who really couldn't find work elsewhere and were quite unreliable and often very unhelpful. So Thomas Fliedner, and this is why I said he was innovative, he saw an opportunity to combine his desire to see people lifted out of poverty and given meaningful work with the need for a more highly trained and disciplined workforce. So he started what we call the Deaconess Training Program. It started in 1836 in Kaiserwerth, Germany. And they developed a training program whose aim was to produce responsible, knowledgeable, and skilled nurses, nurses who could provide care of the body and care of the soul, with a focus, of course, on care for the poor and the marginalized. Now, it was here at this deaconess school in Germany that Florence Nightingale first trained as a nurse. So because she'd heard about it, and so she had wanted to go because she had felt that God was calling her into nursing, and this was a good place to learn about it. So we can see that the impact of Christians on the professionalization of nursing is very evident in the deaconess model of nursing education, and actually how it all started. It embraces care of the body and soul, as well as the teaching of values and virtues from a biblical worldview. So the first nursing textbook was written by a deaconess. Her name was Ulrika Eleanor Niesen, and that was written in 1877. And its opening chapter focused on the values and virtues for nurses that aligned closely with the concept of a religious vocation. Some of you will know this, but the root of vocation comes from the Latin vocatio, which means a call. So vocation was first used among Christians to describe those who felt called by God to salvation in Christ. And then later, it was used to describe a calling from God to a specific type of occupation, normally still tied to religious life, such as a monk or a nun or a priest. And then later as a sense of being drawn or directed to serve God in a specific occupation, of which nursing is clearly one. And this is how Florence Nightingale described her interest in nursing. It was a calling from God. So the link between nursing and vocation is one that has motivated many Christians over the past 150 to 200 years to choose to become a nurse. And in turn, this sense of vocation as a call from God has helped to shape their approach to nursing care. All right. The deaconess education program was and still is to some extent a model that openly acknowledges and integrates nursing work and the Christian faith. Now, although the early professionalization of nursing was rooted in a biblical worldview, and the training included understanding of nursing as a vocation, the trajectory of the deaconess nurses as autonomous professional nurses has been a bit of an up and down journey. So the first textbook taught students about the importance of nursing as a unique Christian vocation. But the second textbook happened to be written by a medical doctor, also a Christian. But according to his nurse historians in Norway, when they read his work, they said that he emphasized the importance of a hierarchy in which nurses were subservient to and assisted doctors. Then we get to the third nursing deaconess textbook, and that was written in the early 1930s, and that reflected a return to the professional nursing trajectory with more input from nurses and alluded to the professionalization of nursing and the expansion of nursing knowledge. So that's just a little bit about that. So we can see that if we look at the deaconess program, it shows that there was a move towards nursing professionalization in the 1800s that came from a biblical worldview, providing meaningful work for the poor based on a spiritual calling from God, good character, a worldview that included care of the body and soul. As mentioned, Florence Nightingale also viewed her work as a calling from God. Her legacy, though, is a little bit different. So she had a nursing education approach that placed greater emphasis on nursing science and discipline and less on spiritual calling. I've not extensively studied her writings, but I would guess that with the rapid advance of science that was happening during her lifetime and the after effects of the social upheavals that loosened the hold of the church over the people, that Nightingale's ability to use statistics She was apparently quite effective to communicate the difference in patient outcomes. That was actually one of the keys to her becoming respected, and also therefore became important for how nurses had a more scientific approach to their nursing work. We know that others also made advances in nursing care at that time. But what seems to have made Nightingale stand out was that she was able to speak the language of the elites of the day. She was a prolific writer. She had good social connections with political leaders and policymakers. And she took initiative in setting up a hospital and a school of nursing. So before we move on, I want to briefly mention one more model of nursing education that's had significant impact on the professionalization of nursing in former communist nations, of which I'm currently in one of those because Mongolia, although never part of the Soviet Union, was certainly within that sphere. So this model of nursing was advanced by the Soviets. Prior to the Communist Revolution, nursing was the domain primarily of the, as mentioned, the religious and the wealthy who were interested in charitable works. With communism despising both the religious and the wealthy, nursing's primary knowledgeable and skilled nurses were no longer welcome to work in the new communist state. So there's a lovely little article, nursing article published by Elizabeth Murray, and she noted in her article on Russian nurses that it meant that there was no ability to pass on nursing knowledge and skills. So she says what happened was Russian doctors basically decided on what they needed nurses to do. And so that's why in some countries like Romania, rather than the term nurse, the term medical assistant is used. In Mongolia, where I've lived off and on, and where I've conducted nursing research, the term for the nursing program has changed over the years. And sometimes it's also been called like a technical assistant or a technical nurse. Currently, it's called a nurse. Often in those countries, or actually, I should say usually in those countries, and until sort of the fall of the Soviet world, nurses were taught pretty much exclusively by physicians. And then, of course, because it was communist and it was an atheist thing, that meant that there was complete omission of anything spiritual in the care of patients. I mean, a lot of people, when they talk about nursing, they only think of the Western model, but I think it's important to remember that many countries are still coming out of the old Soviet model, and that also has an influence on how Christians integrate or feel like they don't integrate their faith in their nursing profession. Okay. So when one considers the changes in the nursing profession over the past 2 centuries, it seems that the development of nursing closely followed societal trends. And this is not my view alone, it's also one that other authors have written. And I think this is really, really important. So science and technology developed and contributed to overall positive outcomes in health, which is great, decreasing incidence, prevalence of infectious diseases, morbidity and mortality, etc. But as that happened, there was less dependence on God. And what snuck in was humanism or scientism, with the person or the ego at the center. And that largely replaced religion and dependence on God as a dominant cultural ideal. And this was very true for nursing. So Dr. Marcia Fowler, who's a retired nursing professor now, and her work focused on nursing ethics, she observed that over the past 100 years, there'd been a significant shift in nursing's worldview and values. And one of that was the adoption of a biomedical ethical framework. So that was based on principles that doctors and others could discuss about how to make ethical decisions. But she said when she looks back in history, nursing tended to be more a relational approach. So you worked out ethical issues in your relationship with others, such as with the patient and their family, the nurse with other professionals, working through issues that the nurse herself had, or the nurse to the nursing profession. So I mention this because it's just an example of how societal thinking, like that shift towards humanism with the ego at the center, influences Christians as well, and how in turn that influence is what we do and how we live out our faith. So the second one was the significant expansion of scientific knowledge and technical skills. Also led to the need for more nursing care. And whoops, I mixed up the order of those. Because of the science and technology, obviously there was less value on holistic and intuitive contributions to care, which nurses traditionally had given. And then, of course, the need for nursing knowledge, and hence the big move from training schools to university education, because there was a lot more that nurses needed to know and understand and be skilled in doing. I also want to mention briefly the importance of hierarchy. And it's not a matter of, woe is, we had hierarchy, but more, I think, just seeing how subtle things, ideals of the world impacted Christians, and I'm assuming most was unknowingly, and then how that impacts how we carry out or integrate our faith in our work. So, for example, professional hierarchy, I already mentioned that the hierarchy changed as science and technology had impressive results. And so one of that was, of course, that nurses became a little more subservient. One really sad example of that was during World War II, when, let me just check my time here. Oh, my time's getting short, so I'm going to skip that sad example. You can ask me about it later, but one of the problems of following orders rather than actually thinking and praying and working through things. I want to talk a little bit about what I've heard about trends in the present, okay? Yeah, so that was trends in the early years, and now trends in the present. And one of them is a focus on well-being. And why well-being? Well, in large part, it's a response to data showing that nurses are overworked, stressed, experiencing burnout, leaving the nursing profession, and then that continues to spiral. So focusing on well-being seems like a good and hopeful way to address the problem of stress and burnout, which I've read, when something seems good and hopeful and plausible, and we need to actually take check. Self-care also is very much in keeping with what society is currently thinking. And if you disagree with my statement, just check out a bookstore or podcasts that are listed. My question when I think about Christian nurses and well-being is, how does our Christian faith impact our well-being? Is it positive, negative, or does it have any impact at all? And I just want to talk to you briefly about two speakers I heard at a NCFI conference in 1921. The first speaker was from a wealthy country. He described the work of a Christian medical team that included several nurses. They went on a short-term mission to Haiti. And Haiti's a difficult place. The speaker talked about the importance of preparations, pre-briefing, daily debriefing if they could make the time, because there was a lot to do, and then also a debriefing after the team returned home. After him, a Haitian nursing director was another of our keynote speakers, and she spoke about what it was like for Haitian nurses to care for the sick and injured, some of whom may have inflicted violence on others, and how to care for patients in poorly funded, low-resource hospitals. Haitian nurses had no pre-briefing, they had no debriefing. There was no realistic hope that conditions would change or that they could leave and go to a better place. So when asked how they could continue day after day in those conditions, unlike the short-term team, she said she didn't really know, except for the grace and strength from God. There's nothing else. Ponder these two stories for a moment. How do Christians approach the important area of well-being? What is it that we depend on? Now, I'm not advocating that we don't do pre-briefs or debriefs or try to be Haitian nurses, because we're not. Pre-briefs and debriefs are important. But as I think, especially about our next generation, I wonder how much of what we do or how we think has been distorted by the thinking of the world. Are we actually unknowingly being led by societal trends and thinking? Or are we being led by God? Are we reflecting our society's culture? Or do we stand out and lead in a different way? St. Augustine wrote that in order to discover the character of people, we have only to observe what they love. What do Christian nurses love? What would their colleagues and patients say about what they love? If we follow Jesus's example, then that will lead us to seek one primary thing: to do the will of the Father. And that's key to integration of faith and work in nursing. When we integrate our faith in our work, we understand our work as worship. It's worship because we seek to do the will of the Father. And as we seek the Father's will, our character is transformed. Habits. Remember Phoebe, the nurse I told you about? Habits is what changed her nursing practice. We often quote the verse from Jeremiah, and that's in italics there. But how do we today find the good way? And I'd say one way is to engage in good habits. Spiritual habits, but also physical, social, and intellectual. They're absolutely essential if we want to integrate our faith and work. And it's interesting to me that our minds are thinking is an important part of that. So in the Bible, minds and thinking can be described as dangerous, but also something that can be transformed. Christian nurses need to learn how to engage in healthy Christian thinking, and that will be by developing habits, some taught and hopefully best modeled. And then there is the importance of community, where people feel they belong, in which they can contribute and also receive. I have a feeling my time is up. I was pretty close to being done. And so just looking at what makes Christian nurses different, living in a way that stands out to others. I do have more stories. But I'm also just want to say a little disclaimer. I'm a bit cautious sometimes about saying integrate faith and work, because my hope is that the faith would be a godly biblical faith. But we also know from history that sometimes when we integrate our faith and work, it's not actually honoring to God, because something's gone wrong with our faith and our distorted way of thinking. But our goal is to honor God. And I think that will come when we have healthy churches and when we've got supportive organizations, such as a group like Nurses Christian Fellowship, who's got a specific purpose on encouraging and equipping Christian nurses and midwives to integrate faith into their professional nursing practice. And just an example of how we can do that in a number of different ways. And I'd like to conclude by saying to integrate faith and work requires an understanding of work as worship, in the sense of seeking to do the will of the Father. And this should impact our character, our habits, and our thinking. As we look at the future and how Christian nurses can integrate their faith and work, it's important to acknowledge that we failed at times. And it's had profound impacts that's either weakened the integration of faith in the workplace or it caused obvious harm. But when we nurture a nurse's character, habits, and thinking, that becomes integrated into their nursing work. Integration of faith is not the combination of two separate parts of a nurse's life, but rather enmeshed or truly integrated way of being. Whether one is in a society that allows free expression of your faith, or whether one works in a society where the Christian faith is repressed, a Christian nurse can and should integrate faith and work. So I think that's it. Thank you so much. And I'll stop here.
Dr. Biro, thank you so much. You have brought so much to us, and I wish that we had a whole weekend because each one of those sections of your talk could have been an entire session itself, and we've never actually engaged the deaconess tradition much here. So I'm really grateful for all that you brought to us and for your career and for your thoughtfulness and for your faithfulness. So thank you. We don't have time for Q&A today, but I'm really grateful for all that you've brought to us. And to you, Dr. Biro, I'd say thank you so much for joining us for the TMC seminar. And to all of you who have attended, thank you for joining us. And please rejoin us for our next TMC seminar on November the 14th, when we'll welcome Dr. Sanita Puri, who's an author and physician on the topic on dignity and suffering in life's 11th hour. Thank you all so much. Thanks again to Dr. Biro, and go in peace. Thank you.